every dentist does crowns, as an example, okay? But crowns can be done many, many different ways. And analog is all slowly changing to digital. The problem with that is if you can't do analog well, you can't do digital well. So you have to be able to incorporate that. So there's lessons from analog that you need to bring into the digital workplace. And here we use analog for the beginning of it, and we finish it up digitally because the scanners that you use intraorally are not as good as all the other scanners that are used in dentistry, the ones that are on a tabletop at a lab or whatever. So that's the thing that's holding us back a little bit, is those scanners. So the analog impressions that you take are better than what scanners do. But scanners do a better job integrating with milling machines that we use to make a lot of the crowns. So we combine a couple different things. We use analog impressions because they're more accurate, and that's been proven statistically. It's absolutely the way it is. We then take a scan of our impression, so now it's accurate. We then have the models come to us, and we do our own die trimming. It's just part of the model work that you use to make the shape you're going to make a crown on. So we get our shape as accurately made as we possibly can, send it back to the lab. Now the lab has something that's as accurate as you can give them to make a good crown. So if you send them bad work, you're going to get bad work back. Very few dentists trim their own dies. Very, very, very few. It's the most important thing that I learned. I learned it from another continuing education series that I went through with somebody from Fort Lauderdale. And he made the comment, you can never, ever control the quality of your practice unless you trim your own dies and do some of this work yourself, because the person who's doing it in the lab has never seen your stuff. He wasn't there with the patient. He doesn't know what happened. So we've tried to combine all those different things, and it has paid off.